clotting during your period. 5 things you should know. Although the presence of blood clots is normal during most women's periods, it's also something that you should keep an eye on to see if it's associated with any other symptoms. It never hurts to check in with your gynecologist. As the experts tell us, however, every body is unique and every woman will experience her period in her own way, so the presence of blood clots isn't necessarily something to be alarmed about. We'll give you all the details below. What are blood clots that occur during your period? To better understand the blood clots that you may see from time to time during your periods, pay attention to the following facts. The walls of your uterus tend to change gradually to prepare your body for a possible pregnancy. They become thicker and filled with new tissue so that if you conceive, they can support a fetus. In the absence of a pregnancy, the extra layers that have formed along the lining of your uterus are gradually released, causing menstruation itself. When you suffer from most wounds, your blood tends to clot. This is your body's natural defense to keep you from losing too much blood. During your period, however, the blood needs to flow more freely in order to be expelled. That's why your uterus produces an anticoagulant. If your period is very heavy, that natural coagulant runs out and you will usually notice some blood clots. Typically these blood clots will range in size from 5 mm to 2 inches, and they are more common in women who have very heavy periods. Those with lighter periods may never experience these symptoms. Another point to remember is that the clots are more commonly formed during sleep, sometimes causing a thicker and sometimes frightening mass. Things to remember about clotting during your period. 1. Iron deficiency. A lack of iron can sometimes be a real headache for women. It's common for a heavy period to cause you to lose levels of this mineral, but another aspect of it is that the less iron you have in your body, the more difficult it is for your uterus to generate that natural anticoagulant, meaning that anemia can in turn trigger more blood clots to form. That's why you should periodically monitor your iron levels and take supplements if they were recommended by your doctor. 2. Small hormonal imbalances. It's common for both adolescent girls and women who have recently given birth to have problems with blood clots. This is due to small imbalances in estrogen and progesterone, which can also occur just before menopause. 3. Miscarriage. This is something that's important to consider. If you are trying to get pregnant and notice that a yellowish or grayish clot appears, it could unfortunately signal a miscarriage. Never hesitate to consult your doctor or gynecologist. 4. Endometriosis. Endometriosis is the silent disease that millions of women suffer from. Something to remember is that if your periods are extremely painful and disabling, it's possible that you too suffer from this ailment. Endometriosis affects the female reproductive organs and is characterized by the formation of very dense lesions around the uterus and other nearby organs. All of this causes pain, which is more common during menstruation, and you also see abundant blood clots. 5 Common gynecological diseases. As we noted in the beginning, the presence of blood clots is common in many women. If your periods are painful, however, you should always discuss it with your gynecologist. Pelvic inflammatory disease, for example, is usually associated with deep abdominal pain in the pelvic region and is also related to the presence of blood clots during menstruation. This type of disease, caused by a type of bacteria, results in an infection that spreads from the cervix to the uterus, fallopian tubes, or ovaries. It's painful and one of the most common gynecological diseases, so it's important that if you are in doubt or discomfort, you consult a professional. It is also known that the presence of fibroids or cysts is also associated with clotting during your period. So even though clotting can be normal, it never hurts to mention them when you go to your annual checkup.